We're seeing three trends in the HLS industry. HLS has always had very stringent industry-specific regulations, such as HIPAA. So a lot of this information has been safeguarded pretty well and protected. But what's happened is in the last few years, there are two new trends that are affecting this industry. The first is the rise of global privacy laws, such as the GDPR, CCPA, LGPD, and others like that. So if you operate in any of those regions, such as Europe or United States or Canada or any of these other ones, there is a greater emphasis on the privacy of this information. And that not only means who has access to see it, it also means how it is used and how long we keep it for. So in the Salesforce context, it can translate into permission-based marketing, such as consent and preference management. It can translate into right to be forgotten and data portability type requirements. The other change that we are seeing is coming really from these laws and also from an increased focus on data security. Lately, there have been a number of incidents across the HLS industry. We have seen hospitals being attacked, from a cyber threat. We have seen pharmaceutical companies. We have seen medical device companies. All of them have been affected. And on that front, in Salesforce, you're looking at two different areas. You're looking at how do I reduce the amount of sensitive information that exists in my production Salesforce org? And secondly, how do I mask and completely de-identify all the personal health information that exists in my Salesforce sandboxes? And a combination of these two, both in terms of data retention and minimization on the production, and in terms of sandbox data masking, is the trend that's fueling more and more security-led requirements to make sure that our Salesforce information of our patients is safe. At the end of the day, when you look at the industry and you look at Salesforce partners like us, the intention here is to continue to safeguard the trust that has been bestowed upon us by our patients, users of our services and products, and to do it in a manner which makes sense from an enterprise architecture perspective so that it's scalable, it doesn't add a lot of technical debt, and it actually automates a number of these processes so that there is standardization and we don't have any human errors associated with it or minimize them as much as we can.